You deserve it.
No, I don't. I only did one for
No, you deserve it. For all the times I didn't pick you this semester when you called yourself that.
Good morning.
Good morning.
All right. So I think you are the class that has moved the most since I've ever been here. So congratulations on that. Thank you so much. That's okay. Did y'all have an exam this morning?
We feel like.
All right. So last class we started talking about pet birds. And we started with bacterial diseases and then viral diseases. So we are going to continue with the viral diseases. So we ended on Amazon tracheitis, and we are going to start on Pacheco's disease. So Amazon tracheitis, as I said, is etiology is a herpes virus, and so is Pacheco's disease. So the etiology is pseudoseed herpes virus, and transmission can really be through contact with other birds or ingestion of feces. Again, most of our pet bird diseases affect our pseudocene birds. So what is considered a pseudocene bird? Budgies, what else? Huh? Cockatoos, yes, cockatiels. Those are the birds that fall into that category. So cockatoos and Amazon parrots are highly susceptible to this disease, and often the main clinical sign you see is acute death, which is really not a clinical sign, but more of just a common occurrence. They may have yellow-green diarrhea in comparison to, what is this other disease we look at the color of
Chlamydia.
the diarrhea?
Chlamydia.
Chlamydia, right. So psittacosis or chlamydophila, you have more of a lime green diarrhea. So the lesions you see with this disease is enlargement of organs such as the spleen, liver, and kidney, which again can cause some confusion with chlamydia. So chlamydia, one of the common things you see is hepatomegaly and splenomegaly. So again, if you have a bird and you open it up and see enlargement of organs, those are the two diseases you should have on your differential. But the main thing to remember is one is caused by a viral etiology, which is the herpes, so you expect to see intranuclear inclusions, while psittacosis is caused by a bacteria. So can anybody tell me what inclusions we see with psittacosis? They're caused, there's a special name for them. Thank you so much, sir. Elementary bodies. So they're not intranuclear or intracytoplasmic inclusions. They're not viral in etiology, they're bacterial. So the thing you see with psittacosis is elementary bodies. And the reason I'm bringing that up is when you have a case, which I will give you cases, and we talk about enlargement of the spleens, enlargement of the kidneys, or enlargement of the liver, and we say there's diarrhea, you really cannot tell which disease unless you do more diagnostics. And one is zoonotic and one is not. So which of the two is zoonotic? Chlamydia or psittacosis, right. So it can affect people versus Pacheco's, which is not a zoonotic disease. So this is in a psittacoid with Pacheco's disease, and if you've ever done a necropsy on a bird, let's look at some basic patients. Bless you. We're opening into the coelomic cavity, and this is the heart, and it's paired markedly enlarged, which is one of the common things you see with Pacheco's disease. And of course, we have other internal organs, the intestines, in the base of the coelomic cavity. So this is really an older picture, but I do like the appearance of the liver, which is the classic multifocal areas of necrosis. So when you think of herpes virus, regardless of the species, that is a common presentation. When you have the liver and you see multifocal white spots within them. So again, this liver is not only enlarged, it has multifocal areas of necrosis. So again, this is the liver, and this is the heart here in the upper aspect of the coelomic cavity. So Pacheco's disease will be diagnosed by using virus isolation, and if you do histopathology, you will find those intranuclear inclusions. And so what color are herpes virus inclusions typically?
Basophilic.
So they're eosinophilic, right? Versus something like, what's the one that's basophilic? So they're eosinophilic intranuclear inclusions. When you have liver involvement, you expect to see your liver enzymes to be elevated, and the best of these other tests, but the first one you go to is virus isolation. You can control and prevent this disease, and most of our diseases we'll talk about, the control is via good hygiene. That means that you isolate birds that are carriers or infected, and then vaccine is available, but it's not required in every state because it does have some side effects. So vaccination is a possibility, but sometimes the side effects can be pretty adverse. So the best way to control or prevent is just strict hygiene with your birds. Acyclovir is the antiviral medication that is the drug of choice for Pacheco's disease. But again, we always worry about transmission, using your hands from one bird to another. But it is the drug of choice for this viral etiology. So what is the main things to remember about Pacheco's disease? You want to remember the clinical presentation, which is usually none, usually acute death. You may have yellow diarrhea, and then you may have enlargement of both the liver and spleen and kidneys associated with that. Histologically, we see intranuclear inclusions, and the drug of choice is acyclovir. So those are the primary things you need to remember when it comes to Pacheco's disease. Any questions about that? Pretty straightforward. The next disease is proventricular dilatation disease or syndrome, and it's caused by a Borna-virus. So Borna-viruses we have talked about previously in what species? It's a large animal.
Horses, cows, sheep,
Not in cows.
sheep,
Sheep and goats?
goats, horses, pigs,
What?
chickens.
In horses. So we went through every species, but of course, that's okay. So it typically gives you a CNS disease where they present with CNS signs, incoordination. They may have issues with walking and just anything associated with CNS. So the same thing occurs in the bird. It causes inflammation in the central and peripheral nervous system. It's also caused as a wasting disease, primarily due to the clinical presentation. These birds basically waste away. They become extremely emaciated. And the reason is that the inflammation affects not only the brain, but also affects the nerves that are important for the proventriculus and the ventriculus to work, so in terms of receiving nutrients. We find it primarily in macaws and cockatoos, and it is a fatal disease. There is no cure or even treatment for PDD. Clinical signs are nonspecific. Initially, they're depressed. The weight loss can be very extreme. And we have regurgitation. Regurgitation to the point where when you see the bird, they may have dried, caked, undigested seed on their faces. So the seed is not being processed in the proventriculus or the ventriculus, and when they regurgitate, it sticks on their faces. Yes. Face and two parts. So they regurgitate it, it sticks on their face. When it does come out in the feces, the seed is also not digested. So if your proventriculus is not working, so I can't remember if you ever done crossing birds. Look at you.
No.
I'm sorry. 7 years doing that right now. That's the point. So the ventriculus is used to grind the seed. It has a very thick mucosal lining, very muscular, and so it's used to grind the seed, and if that's not functioning, we have the passage of undigested seed in the feces, so it comes out through the cloaca, and it also regurgitates those undigested seeds, and it ends up stuck on their face. So that's a very highly indicative sign of PDD or PDS. So this is a bird. This is one of the few pictures I can find with a bird with regurgitated seeds on his face. I always say this bird reminds me of the cockatoo in Rio. He had that movie. I watched it too. But I had an 8-year-old. So we have regurgitation of mucus-like fluid, and that's classic signs. And remember, it's adhered face, feathers, because they're not processing the seed properly. Other signs, the proventriculus and the ventriculus starts to enlarge. Then you see abdominal enlargement, and when you open up the bird after death, you see both those organs are enlarged. You may see central nervous signs because it also affects the brain. So the pathology that you see, emaciation, dilation of the esophagus, proventriculus, ventriculus, and even other small intestines, and we'll see prominent keel or pectoral muscle atrophy. So these are your classic signs of PDD syndrome. This is a normal radiograph, and this is showing you a markedly enlarged proventriculus. So that is, again, showing you that you have enlargement of the proventriculus. So why do we have enlargement of the proventriculus? Why do you think that? Or the ventriculus? Well, the proventriculus. So what did I say is going to happen? Why do we have this disease? What is the virus affecting? The nervous system. So what is the nervous system going to do? What does it cause? Everything. Yes. So what happens in your GI tract? You have peristalsis. Yeah. So up and down. So if you have absolutely no ganglions present, what's going to happen? Everything's going to stop. So when you're ingesting food is going to go down to your proventriculus, and then it's just going to get larger and larger. It may eventually pass to the ventriculus and then out through the rest of the intestinal tract, but it really can cause the proventriculus to get markedly enlarged. So this is a bird with PDS, and again, let's orientate ourselves. This is the heart. Liver is being pushed to the right side, so typically it occupies the most upper aspects of the sigmoid cavity, but because your proventriculus, which is right here, is distended recede. So again, we have loss of ganglion action, not moving, everything is just going to accumulate in there, and then this is your ventriculus here. So ventriculus is because it has a very muscular that the bird is going to experience. So the reason birds don't eat, become emaciated, one, you have real processing of the seed, and the fact they have such painful abdomens. They're not going to continue to eat. eventually they're going to stop. And this is your ventriculus in comparison to your proventriculus. So again, you remove the C small, the crop area, but this can also occur in the proventriculus. So remember we said the nerve ganglion there are primarily affected, and that's the cause of PDS. And this is an H&E section. Again, this is not pathology. I just put that in there just to remind you. This is your lymphocytic inflammation affecting your ganglia. So the two areas it's going to affect include what? Your proventriculus, your ventriculus, primary areas, and it also affects areas in the brain. So we can have CNS, we have seizures, ataxia associated with diseases as well. And this is an H&E section from a brain of an animal inoculated with this disease. So here are your neuropile, and we're just emphasizing the lymphocytic inflammation within the brain. Treatments, absolutely nothing. 90% of these birds, well, 100% of these birds will succumb to this disease. So really there's no option in that. You may make them comfortable temporarily, but they will die from marked dehydration and anorexia. You could do radiographs to diagnose, and you can also look at biopsy of the proventriculus or the ventriculus. But this is a classic disease that most likely you will not be doing biopsy because if you see enlargement of the abdomen and then that marked emaciation, that should really indicate to you that you're looking at PDD. So, what is the common thing that sticks out for PDD? What's that? Jasmine. Yes, your name is Jasmine. I'm sorry. Yes, Jasmine. Very good. Anybody else? I will just call you. Bradley. Listen. Hi. I'm used to seeing you over here. So what else do you see besides that's you? What else do you see besides feed on your face? Okay. I love your honesty. Ariel? Ariel, I apologize. Oh. Oh. Now, you know when I walked in here, I thought about giving you a quiz. That's why I asked, did y'all have an exam? So typically, when I just get a dead classroom, a quiz will kind of wake everyone up, right? But I'm not like evil. If you have an exam tomorrow, I get it. But I expect you to somewhat. I just said what we talked about. I think none of what, I'm not saying anything complicated. Am I saying anything complicated? If I am, please tell me so I can just, chain it around. Go ahead. Thank you. That's the name of the disease. But yes. All right. What about Jamie? What else do we see? All right. Yes. Thank you. Yes. So that's one of the common things you will see with this disease because again, they're not processing the seed, and the bird is eventually going to get severely emaciated. They may have a distended abdomen because we have enlargement of the proventriculus. So, quick review. We talked about some bacterial diseases. We talked about silicosis and mycobacterium. All right. Brandon? Is Brandon here? Oh, Powell. Okay. typically, so I have to, I'll tell you a little secret. Every year around this time, and I teach in this class, I have packed and went to my office because I get no response. This year, I said I'm not doing that. I didn't do it last year. Because I understand, but at the same time, if we're talking about something, if you're not here with me, it's best that you just go to the library and study. Because I don't get if you're just going to sit here and just not pay attention. But we will continue. Angelica. What is the treat? Is Angelica here? No, not here. Okay. All right. Take out a piece of paper. We're just going to have a quiz. Don't blame your classmates. No, don't. I don't do half sheets. I have like this thing again. Because I will lose your little half sheets. And these are going to, now let me ask, for the people who are here, these are bonus points. It's not part of your addition. Because you came to class, because that's what you're supposed to do. If you're not here, you're missing. All right. All right, first question. What does it mean when we have a prominent keel? What you use one word. Prominent keel.
Prominent keel.
Keel.
How do you spell
Bone keel. Make sure your name is on the paper. One word. If you can't figure out one word in a sentence, as long as it's going to be, I don't care. Keel. If you can figure it out with one word, great. It doesn't have to be one word. We'll go through it after. Everybody got that? Number 2, what is the drug of choice for silicosis? It doesn't matter. All right, number 3. What is the etiology for Amazon tracheitis? What? I'm laughing. I need to cry. All right, number 3, what is for?
Yeah.
Number 4, what is the drug of choice for the Checo's disease? Number 5, last one. What gross lesions do you see with Pacheco's disease? Just give me one.
Could you take this, Siobhan?
Oh, that's fair.
And that's the one. Malnutrition. She'll probably say that. It's in her name.
Number 2, drug of choice for fertility.
Doxy. Oral doxy.
Dr. Gorham.
I did too.
Number 3, what is the etiology for Amazon tracheitis?
Lucky guess. Come on, Charlie.
Is he dancing?
Get it.
Drug of choice for
Cyclovir.
Did I put that?
Wait, did she ask us right?
I like you said no last. Right. Big level. You got a big level. I didn't hear her right on that one, but this was
Large everything. I put a large. Just large. Hey.
okay, awesome.
Okay, so we are going to continue. I think we'll do. Going to the next viral disease, which is citizen beak and feather disease. So citizen beak and feather disease, pretty much, I don't know if you notice, birds, whatever they name it, they're not trying to make it complex. This disease affects the beak and the feathers. Understood? So it is a circovirus, and like PED, it's also fatal in citizens, especially cockatoos. And the primary thing you see is irreversible feather loss. So we have naked birds. That's pretty much the common thing you see. The developing feathers start to shed. They have abnormal pin feathers, which they can be constructed, clubbed, or stunted. So what is a pin feather?
It's after they're mown.
Right, so it's right when it's coming out from the skin itself. So you have to like sort of separate the feathers on the birds to see those. But they can be abnormal, constricted, clubbed. You have abnormal mature feathers, and their beak can be cracked and abnormal. They may have ulcers, fractures, and these birds are typically immunosuppressed. So this disease causes marked immunosuppression, so they're could be infected by other secondary bacterial agents. So this is a typical presentation of citizen beak and feather disease. As we can see, we have marked feather loss, and if you do have feathers, they're sort of stunted. They may be, if you look closer, they may be sort of irregular. And when a bird loses its feathers, what happens? What else can happen?
Skin infection. Temperature regulation.
Very good. So they lose temperature regulation. Oh, hold on after you answer a question. have little ulcers. Look at this guy right here. You get easily bruised. God forbid you have a roommate, because what do birds do when they're together?
They prune each other.
They start pecking at each other. Peck, peck, peck. Right. So you see ulceration and damage to the skin. I don't know why this bird is smiling, this is dead, but you have general loss of feathers on the neck, and of the pin feathers on the neck are not emerging. You really can't see that very well, but again, you have significant feather loss. Okay, and this is showing you the beak. You see a lot of cracking and fractures in the beak. So this is a video of, of a bird that had citizen beak and feather disease. And he's so cute.
That's snake food. He's already prepared.
Mama, you were supposed to bring me a towel.
He needs a sweater.
I agree. He needs sunscreen and a sweater.
Everybody in.
I don't have that thing in my house.
You know what I think it looks like? I'm not trying to be funny.
I'd have to get rid of that.
That's what creepy.
He looked like the red chick compared to.
So this is one of the few cases of birds that actually survived the disease. Actually, he's lost all his feathers, except for his head. Obviously, as someone mentioned, his owners have to cover it. Feathers. He didn't have any cracking of the beak that I can see from this video, but it was a pretty extreme case, but he seems to be doing okay. As long as the owner is okay. How do I get out this thing? Ooh.
That bird got one time to annoy me.
Yes, ma'am. They will never grow back again. They are permanently destroyed. So what the virus does is infects the feather follicles, which are down in the skin, and destroys them. So there's no chance of regrowth or any new feathers developing. Most birds do not survive this, so this bird is pretty spectacular that he's still alive. Yes. She's on Google. The bird. Oh, okay. Awesome. Awesome. I love videos of the birds. Can anybody think of another disease that would look similar to this?
Dinner.
What you said?
Fried turkey.
Can you eat a bird with that virus?
An endocrine disease that causes hair loss.
Cushing.
This isn't in chickens, though,
No, not too
right?
much.
These are pet birds.
And birds. are just-
Hypothyroid?
Hypothyroidism. So hypothyroidism causes hair loss, and these birds with cracking of the beak, but they will be little ball birds, like we saw with that one. So that's you should put them in a differential. So diagnostics, you can do a biopsy of the feather follicles, and it will show basophilic intracytoplasmic and intranuclear inclusions that are typical of the virus, and that would be very helpful. You can do PCR. The cases that I've had of this, we typically diagnose it with a biopsy. Prevention, again, you want to prevent it from being transmitted to other birds, and removal of all infection. So again, strict hygiene can help with this, but if a bird gets infected, there is really no treatment, and eventually the bird is going to be euthanized. But there, as you can see, there are a few cases where they have survived and done very well. Yes. No, they just want to prevent any dander from getting onto the chicks. So they want to make sure the egg clean and away from any other birds that are infected with that. Now, I can't imagine having a breeding facilities, you have one bird infected, you're going to have to eventually cull that bird and pray that the rest of the flock is unaffected. So citizen beak and feather disease, beak and feather, main thing to remember. Circovirus gives you intracytoplasmic and intranuclear. There's no treatment. Typically with viral diseases, you're going to cull or euthanize. We talk about one disease, Pacheco's disease, where we do use antivirals, and really the success rate is not even that high on those. So viral etiologies in our pet birds or even our chickens typically lead to euthanasia and death. Euthanasia and death. Those are the same. Was there a question? Yeah. All right, more viral diseases. The next one is Budgegar fledgling disease, and this is a polyoma virus. Again, it affects citizens, and it does feather development. Citizen beak and feather disease, but it can affect their growth and development. When the bird is less than 15 days of age, the mortality is pretty high. So we're talking about our young birds, they have enlarged abdomens, it can affect internal organs as well. And then when they're older, it affects their feathering and their molting of feathers. So what is a French molt? So French molt is when they go for more of the fluffy baby feathers to more adult-like feathers. And so it can affect their development and can lead to abnormal feather growth. A few cases where citizen beak and feather disease coincide with this disease. It's not very common, but it can occur. So two viral etiologies are one. And so this is a bird with a severe case of Budgegar fledgling disease. And again, it looks very similar to PDD, except we don't have beak involvement, so that would be differential as well. And there must be love, because I don't need you snuggling that much to me, and your feathers are falling off. But that's what it is. So this bird has Budgegar fledgling disease, and as you can see, this is a pretty severe case where we have loss of feathers and we have ulcerations on the skin. So lesions are really non-specific. You can have subacute hemorrhage. We do have enlargement of similar to Pacheco's disease, the herpes virus, and we can have intranuclear inclusions occurring as well. So diagnosis is via PCR and just presentation, and obviously ruling out your other differentials. We do have lesions in the heart, and you see multifocal areas of hemorrhage on the epicardial aspect, and some of these areas are actually areas of infarction and death, but the typical lesions are going to affect associated with the skin. And again, hepatic necrosis. So it's going to be hard to differentiate this from the herpes virus, and so you want to make sure you do PCR to differentiate the two, or H&E. I would really recommend that you put these diseases in a table, because by the end of the semester, they're all going to start to sound alike. So some have similar appearances, for what we're seeing. This disease primarily affects the skin, but it can have liver lesions similar to herpes. So as you go through the semester, I would recommend you put things in a table, and it will be very easy for you as you start studying for your anatomy, which you'll be taking next year. Ooh, time flies. So I'm pretty sure you have these answers. I don't know why I sent you the ones with the answers. So just FYI, a flock of flamingos is called a stand or a flamboyance. Yes. And just a FYI, I don't think the males in this class class, and I'm like, this is a fact, and I'm sorry, just FYI. Female chicken will mate with many different males, but if she decides after the deed is done, I did not write this, that she doesn't want a particular rooster's offspring, she can eject his sperm. And this occurs more often when the male is lower in the pecking order.
Now, how can you do that?
Just FYI. I thought that was so interesting. I don't know where I took this. And I'm like, who wrote after
Unless
these?
you the rooster everybody
Take that
wants.
out. That's appropriate. Not sure that's professional.
You read
And he can.
That's what it says.
And can anybody tell me what's the name of this bird?
Woodstock.
Woodstock. So later in the semester, we're going to do a little bird cartoon quiz.
Oh, I'm away.
And I need one person who can type really fast, and everybody else identify names. We're going to do that probably next week.
Charlie Brown.
We got Charlie. Oh, I thought you said Charlie Brown. Yes, Woodstock is from Charlie Brown.
So Snoopy's homie.
But all right, so we have 8 minutes, and we are going to stop here. What is it? Tuesday, Thursday, we will finish off pet birds. So I know y'all are concerned about when the quiz is and when the exam. I work with you on this one. So I think Sharon already told me did you give me a date? No, you didn't give me a date. Do you want to give me a date for the exam? For radiology. All right. So it's not a big to-do. We can work out the schedule and even a quiz. Last year, I think I did do a take-home quiz because the semester is just really tight at this point. So I will work with you. But y'all, please pay attention. I can't work with you forever now. Wake up. I understand you have an exam on tomorrow, right? Do you have one on Friday? You do, I give up.
Yeah, we.
No, it got moved.
Good.
It got moved to Monday.
Wait, what's Monday?
All right, any questions?
Surgery.
Oh,
All right, so these are pretty straightforward. Just again, I would recommend a table for oh, yeah, I said just a table. Go ahead. We don't know, until it actually gets closer to the Tuesday. I typically, what is it, Thursday or Friday? I'm with you in the same boat. So typically, if the school closes, they will send an alert, and from the past experience, it has usually the evening before, and then I can send something, or But until the university closes, we are not allowed to just shut down the school without prior notice. So obviously, we will not have you hear there's a hurricane, but again, we can't say anything until we get prior alert across campus. That was Friday, so it's tomorrow. Any other questions? I will have, we had to redo the tickets because there was some concern, and I'm sure no one in this class would ever do this, but the thought was, what if people reproduce tickets? And I'm thinking, you know what I mean?
This gonna make it happen.
And I said, yeah, sometimes. I don't